It's cool.
All right, we're back. Cool. So today, on another episode of Simple Science, we have Dr. Shannon Russell. She's a doctor of physical therapy, a certified strength and conditioning specialist, and USA weightlifting coach who has built a career at the intersection of science, movement, and long term health. She's a former collegiate athlete turned clinician and coach, which I'm really excited to talk about today. She is very, very passionate about helping people train smarter, move better, and build strength without sacrificing their bodies in the process. Through her work in the clinic, her writing, and her educational content, she blends cutting edge research with real world experience to create practical, sustainable strategies for performance and wellness. So today, we will be diving into her approach to training, recovery, and building a body that's not just fit for now, but fit for life. So, Dr. Shannon, thank you so much for joining us on an episode today. How's it going?
Sorry, can you repeat that? I just had to switch my Wi-Fi there.
I was asking you, how are you? How's everything going right now?
Doing great. I'm very excited to chat with you today, Mike, and be on this podcast and yeah, just, talk all things performance and rehab and, give people some good information today.
Awesome. So, what personal experiences, because like we don't really know each other too well, what personal experiences have you had that has shaped your athletic journey? And then you being a physical therapist as well as a coach, what does that look like over the course of the past few years?
Oh, man, I could talk forever about that. It's been a
Please,
journey.
yeah, we're gonna branch off and talk about different things then.
Yeah, absolutely. So I guess I'll kind of take it back into high school is kind of where I got my interest into nutrition and the exercise science field. I was always trying to find different ways to become a better volleyball player because I had hopes of, playing at the collegiate level. But at the same time, I was a teenage girl, right? And I always had those body image issues where I also felt like, all right, I'm this high level volleyball player. I'm trying to play in college, but I don't feel like I look like, the athlete that I am, right? So, that is kind of what initially got me into this whole field in general was that combination of trying to become a better athlete but also overcoming those body image struggles, that a lot of teenagers and a lot of adults have as well of, okay, I also want to look like an athlete too. So, I mean, as a lot of teenagers and women's and probably men as well, I tried everything when I was in high school that I could think of. I started long distance running because I thought that was going to be the key. Not great for a volleyball player, right? And then going into college, I would try doing cardio on top of my volleyball practices, and I would try just cutting calories, cutting carbs as a college athlete. Like, let's see how little we can eat. Um, so I kind of tried it all of those like nutrition and weight loss trends, right? And nothing seemed to work. It certainly wasn't making me a better volleyball player. Um, and then, what started to change the game for me was when I did get to college and I was introduced into the weight room. That started to change the game because I was able to focus on performance and building strength, and I loved it. And it made me appreciate my body more for, oh, wow, like I'm strong, like I can do this. And this is really helping with my volleyball as well. And I started to just build that confidence and kind of get away from those body image issues a little bit. They were still there, but that was kind of the first piece of that whole puzzle there.
And then that led into you learning more education and getting into grad school. So where was like, so you're building up now, you're starting the education. Where has that happened, or where has that approach taken you, like immediate post college into grad school, and now as like a coach, professional physical therapist?
Yeah. So then from there, I was an exercise science major. So just really enjoyed learning about the body. Thought it was so cool how, one thing affects the other. And then when I had some shoulder issues as an athlete, as a lot of volleyball players do, the fact that I was able to fix that with targeted exercises from my strength coaches and my ATs and from the research that I was doing, I was like, this is so cool. Like you can actually fix injuries with exercise. Like, whoa, no way. So then that is what took me into PT school and my interest there. But I always knew I never wanted to just be a regular PT, I guess you could say. I always had an interest in um, sports and rehab and working with athletes and active people, much like myself and my teammates, seeing the injuries that they had gone through. And so that was always kind of the population that I wanted to work with. So from there, during PT school, I worked as a strength and conditioning coach for youth athletes, high school athletes. So I kind of got the best of both worlds there, working as that strength coach while I had, that PT school influence, and then getting into my first job post PT school. I had the job where I got to work with the active adults and the athletes, and start to piece that all together. All while at the same time I was kind of going through my own nutrition and fitness journey as well. So it all kind of started to come together, I would say, in PT school specifically.
Do you think that really focusing on other people has helped your own personal journey as well? Not only for the performance seeking folks, as well as some of the younger and older folks who are just looking to get back up to speed. Has seeing their perspectives helped you personally as well throughout your journey?
Absolutely, 100%, because it makes you realize like, wow, we really are going through the same things. We really do all have the same struggles with, injuries and body image. And no one, unless you're in this field, unless you've really, dived into it, like so many people they don't know where to begin when it comes to nutrition, when it comes to their training, when it comes to, having an injury. So many people are just overwhelmed with where do I even begin with this? And that's exactly how I felt for so long as well. And that's kind of why I kept going and kept going into all of this and learning more, right? Is because I'm like, man, everyone else is overwhelmed. I'm overwhelmed. I want to bridge that gap so that other people don't have to spend years and hundreds of thousands of dollars on an education to learn how to do this stuff.
And like, do you think that your approach to physical therapy might be a little bit, I'm not going to say unconventional because I feel like that's like a negative connotation, but like, do you think you almost like you plus it or you supercharge a little bit because you're like, hey, like, yeah, I want you to get back up to baseline, but actually, I want you to get a little bit better.
Absolutely. It's definitely not the standard, right? Because if you've ever been to standard traditional rehab, I'll kind of paint the picture for those of you who maybe have never been to physical therapy before. Standard PT is you're probably going in, you're doing very low level exercises, you're maybe seeing the actual physical therapist for 15 minutes. And then you're kind of on your own for the rest of that hour. Your exercises are probably not really being progressed. If you're a high level athlete, forget about it. They're probably having you do body weight exercises that you do as a warm up traditionally. Um, and it's just, I find that for active people, it's just not enough, right? Um, because there's so many different things that influence the body and pain and movement and rehab. So a question that I was, getting asked a lot by my clients when I was working in the PT setting is, okay, well, this is what we're doing here, but what should I be doing in the gym? How should I be, progressing this? Or, hey, I used to be a runner and this, back pain set me back. So now I've put on 20 pounds and I don't know what to do about it. Like, what should I be doing with my nutrition, from that standpoint too? I want to get back to my old body. I want to get back to running again. This is great what we're doing in here, but what else do I need to be doing outside of here to align with my goals? And that's what kind of got me thinking like, okay, this is a lot of the same struggles that I went through as well, right? The nutrition piece, the wanting to look a certain way, but also move a certain way and feel a certain way. And we really are all the same, right? We all want that as high level athletes and active adults. So that's what kind of got me thinking like, okay, I can really, change the game with this and do something that encompasses, all aspects of health, where if you have an injury, okay, we can, address that from the root cause, find out what's going on, give you some corrective exercises, but also complement that with what you're doing in the gym. Let's get you training. Let's get you strong. And then from a nutrition piece, okay, let's also help you feel good because nutrition also helps, fuel recovery, right? So let's teach you how to build muscle. If you want to lose weight, cool. If you want to put on muscle, cool. Nutrition is a huge factor with that too. So, we just hit it from all aspects of health.
Do you think that I don't know. Do you think that the field is heading in that direction, or do you think that PTs need to take it upon themselves in their interest to go further that? Because, like, as an example, I was a PT aide for like 2 years in college because I was like, oh, I'm going to do PT. I can just talk with
No.
people all the time. And I was like, I ended up doing like my PhD in like human performance and physiology. And I thought PT was like cool. And then the place I was working at was very much like the copy and paste person was 65 years old, weight, high blood pressure, central adiposity, on dialysis. They had metabolic syndrome, and I was like, this is boring me to death. I was like, we can help them, but like we're not going to help them lose weight, get off dialysis. They're type 2 diabetic. I was like, there's so many other things. And when we did have like a 15-year-old athlete come in there saying, hey, I had a stress fracture, but I'm going to get back in the game. I'm like, yeah. And they're like, no, 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 we're just going to give him some heel races. I was like, really? Because that doesn't seem like the full thing. Like, so what are your thoughts on this? Because I haven't been in PT now for 10 years. So I'm curious to see what that could be like.
Yeah, that's a great question. And so I think, unfortunately, the standard model of PT, I would say, is not moving in that direction. And I wouldn't say it's because the PTs don't want it to, but I would say it's very insurance driven. Right. And so, insurance isn't trying to help you get back to, being an elite soccer player. Insurance isn't trying to help you get to, back to your bodybuilding competition. Um, so from that standard model, unfortunately, if anything, I almost feel like it's getting worse. Um, but on the flip side, I think that patients and clinicians are getting fed up. And I think people are, as I almost want to call it the longevity movement, as people like Peter Attia, Gabrielle Lyon, Huberman, like as they all, people are listening to their podcasts, they're reading their books, and they're really interested in aging strong, right? Like they see if this whole generation of people in their 30s, 40s, and 50s who see their parents aging in a way that they don't want to end up like them, right? We have a lot of people in their 50s and their 60s who are, still golfing and playing pickleball, and they're active in the gym and they hike, and they want to stay able to do those things for the long term. And I think those people are starting to see that lack in the standard model. And I think there's also a lot of clinicians like myself who are also seeing that lack in the model, and we're fed up with it. We're fed up with feeling like we're not actually helping people. Um, and I think, again, there's some power to social media as well. The more people start to see, oh, there is other ways out there. Like there's people who do PT out of a gym. There's people who do PT online. Like there's other methods. I think from, both a patient and a clinician standpoint, it is gravitating in that direction.
Yeah, it's funny. There was when I was an aide, I would always look at the sheets and see what I could learn. And every patient, no matter what implication, no matter what they had going on with them, they always did serratus punches
Hmm.
with like 3 pound weights. And I was like, what are SA punches? They're like, the serratus anterior muscle, which like sits on top of the intercostals. And I was like, why does everyone do that? And they're like, why not? It's like,
Yeah,
what? That's the
clamshells.
worst answer ever. Like,
I know.
why not?
Yeah. And they'll do that 3 sets of 15 for 12 weeks. No progression.
And are you still being booked out with like 2 patients per hour, just like one on top of the other? Is that still sort of the model? Like I had a bunch of friends who went to PT school, and I was like, you guys are really smart. You got into PT school. I didn't. And they're just like, oh yeah, you're happy. You should be happy you didn't go. And I was like, oh, I think that would be a really beautiful career to have. But now I'm hearing it from the other side of like, oh, like we can kind of shift this a little bit if possible.
Yeah. So again, kind of like back to the standard of care is still 2 to 4 patients per hour if you're going kind of that very insurance based, like standard clinic. But I think there is a movement, a new movement of PTs who are doing the one on one care. who are moving to, settings where we're working with barbells. We want to be in a gym setting, or we want to, again, work virtually with people so that they can train in their own gyms. So, kind of again, yes and no to that. I think the standard of care is still there, but there is now a large, like, people are waking up to the fact that, oh, there's more out there than just this standard. Like, I can do something different, you know?
So, what are, I guess, three different things that you maybe already do and you would like to implement for your patients specifically that you would think would really move the needle a lot? Like maybe like a little drop in the bucket, like sends them really far, like has a huge return on investment.
Yeah. So, honestly, as simple as it sounds, so many people don't know how to breathe.
Yeah.
That probably sounds so weird and maybe even a little dumb, but um, the world we live in today, like, we're so stressed out, right? As a population, you could probably agree with this. Like, we're working a lot, we're scrolling a lot, we are constantly on, right? And so if you kind of check in with yourself, you'll find, like, oh, like, I am carrying a lot of tension in my neck. I'm breathing really shallow. Some people are only breathing, through their mouth, and they're not breathing nasally. We're constantly living in this fight or flight mode, right? We're scrolling before we go to bed. We wake up, we're exhausted, we're not sleeping well. And then, we're just on for 8, 9 hours a day while we're at work, right? So, just learning how to use your breath to, one, kind of start tapping into the parasympathetic nervous system, getting out of that fight or flight, learning how to take your body into relaxation, rest, and digest. Two, learning how to get out of breathing in your neck, getting away from those shallow breaths, which also pairs hand in hand with that, kind of parasympathetic nervous system, learning how to breathe using your actual diaphragm, um, and getting some movement through the rib cage. Those things alone, building awareness in your body, where your breath is going, and using that breath work to, again, just get out of sympathetic mode, can be huge game changers for people. And instantly, with the right breath work and positioning, people will feel a reduction in pain often, which is pretty crazy.
Can't imagine that. Yeah, I mean, it makes total sense. So, like, what are some things that maybe you see as a coach and as a clinician that you could help with? Like, people, I know I always ask my students when I talk about like what high blood pressure specifically is, and I like to dive into the details. I'm like, who's the avatar person that would have high blood pressure? And everyone always says like someone who's like slightly hunched over, slightly overweight, slightly stressed out, slightly sweating. I'm like, oh, let's talk about all these physiological mechanisms. So, like, what would you do with some of those folks? And you probably already do this today. And how does that help? Is it more of like a belly breathing approach? Is it like kind of like having that reset of doing like 5 or 10 sort of safety breaths to make sure that your exhales are longer than your inhales? So, what's your protocol, so to speak, to help people with that?
Yeah, great question. So, the first kind of step with that is, one, just getting, I think just being on your back in a supine position and either elevating your legs or being in a hook lying position and getting out of that super extended posture. Um, that's the first one. It's more of an anti gravity position, so it can be a little bit easier to learn how to diaphragmatically breathe in that position as well. And then, the cues that I always like to use is, from there, once you feel your whole back on the floor, we want to feel that waistband relaxed down on the floor. Feel like you're kind of melting into the floor almost. You want to do silent breaths in through the nose. That's going to take the neck muscles out of it. Longer exhales out of the mouth. Way longer exhales than inhales. That's going to help get into the parasympathetic nervous system versus the sympathetic nervous system. So, something like getting all that air out. You're going to start to feel your rib cage move. And for a lot of people, this is going to be a very new sensation for them. They might start to feel their deep abs activate as well, just from that breath. And then, if you can kind of just pause for a second or two, almost hold that position, and then really try to hold those abs, and then breathe in, almost think 360 rib cage expansion. So it's not so much a belly breath as it is a whole diaphragmatic breath. That can be a game changer. We do that for 5 to 8 breaths, a few sets of that. And it just kind of resets your nervous system almost and really creates a nice window for change with the body, whether that be range of motion, pain reduction, you name it.
Wild. Do you think that I'm kind of trying to think about this because I had when I was in PT, there was a lady who was like, I think she was like a longtime yoga instructor,
Mm-hmm.
and she'd had a hip replacement, and she was back in PT in a very fast time, like a week or something. And she was walking with a cane, but she was like walking after a hip replacement. And she told the physical therapist, I haven't been taking any pain medications. And the PT went, no pain meds, like a week after. And she goes, yeah, I've pretty much mastered breath work after doing yoga for 40 years. And I remember looking at this lady, she was probably around 65, like a little bit, not a little bit, she had lost like some osteoporosis and sarcopenia, but she was so like zen, but also rock solid. And she goes, it's all about the breath. And she told me that when I was about 19 years old. And I was like, man, she's got something inside of her. She's like Iron Lady here. And now like I'm hearing it from one of the experts that like you can really push that reset button, decrease sympathetic output, increase, parasympathetic tone. And that can help patient outcomes with like reducing pain and even just getting like your head cognitively to stay in the lane of like not freaking out
Yes.
and focusing on what you have to focus on.
100%. And it sounds so woo woo, right? Especially when you were 19, hearing this yoga instructor saying that, you were probably like, what is this woman talking about? She's nuts. And honestly, the first time I started to learn, this stuff, I thought it was a little out there as well until I started seeing, the people who had failed traditional physical therapy over and over and over again, failed chiropractic, massage, like nothing was working for them. Um, and they would call themselves the toughest cases. And boom, session one, we start to integrate some of that breath work, some work on their rib cage, actually teaching them how to feel different sensations in their body. And the breath work helps with that. It helps kind of, again, like tone down that sympathetic nervous system, tell your body, like, hey, we're safe. Like, it's okay to make change in this state. Um, and within 10 minutes, people would feel a reduction in pain. A lot of the times, significant changes in their range of motion just from the breath work, just because their nervous system was hanging on to that, causing them to just be like locked in, moving like the Tin Man, right? And if we can get that parasympathetic output instead, all of a sudden things start to loosen up. So it sounds so woo woo, but it really provides such a great foundation for starting to then lock in that change, which is where the exercise comes in, if that makes sense.
Absolutely. What is like when you had brought that up before, people who had failed physical therapy, what does that mean and why do people fail physical therapy?
Yeah, I should change my wording with that. I should say physical therapy failed them, not they failed physical therapy.
Okay,
Um,
sure.
because, it's really just the traditional model failed them, right? Um, and I would say the kind of standard person who feels this way, um, usually, let's say they had a low back issue. Those are probably some of the most common, right? And, traditional physical therapy just zoomed in and looked at just their low back, and they did their prone press ups and they did their, glute bridges and their core work that they were probably using the wrong muscles to do, right? Their planks. And it didn't work. And why didn't it work? Because they were just focused on the low back rather than zooming out to look at the whole person, right? Okay, what is their nervous system doing? We've already said that that is a huge component to this, right? And, the sympathetic nervous system kind of pairs hand in hand with that extended posture as well. So if you kind of arch your back immediately, go into that extended posture, you're going to feel your low back. So if we're in that position all day long because we're stressed out, we're in that sympathetic state, yeah, your low back's going to hurt, right? And then a lot of the times too, what comes with that as well. Maybe, your low back is being overworked because your hips don't have the rotation that they need to, be able to play pickleball like you're doing, or, perform your golf swing that you're doing, right? So if one joint doesn't have adequate range of motion, another one's going to pick it up because you're going to find ways to hit that golf ball or hit that pickleball. You're going to find ways to get it done. And that is what traditional physical therapy, isn't really looking at is, that person from the whole body standpoint. What are the joints above and below doing? What's your nervous system doing? What does your sleep look like? What does your nutrition look like? What does your gym training look like? Are you prepared for the movements that you're trying to do? Um, so yeah, I shouldn't say the person failed physical therapy. Physical therapy failed them because of a zoomed in lens.
And do you think, based off of another thing that you said too, that some people will almost take it as a bit of a compliment, like a self promoting, like, I'm the toughest case you'll ever see? Do you think that for those folks who, quote unquote, like, aren't, healed or not feeling better from physical therapy, maybe some, you said like acupuncture and like massage therapy, maybe they're trying some, I don't know, they're trying like magnesium because they heard magnesium was good or whatever it is. Do you think that those people, like, one underlying thing besides stress reduction, besides sleep and nutrition, even like being active, do you think there's a mindset component too of like you either want to get better or like you have a fixed belief system that you won't get better? Because I definitely see that personally with my own life, with like my clients who I've been coaching for a while, is that the people who stick with me and I stick with them for a couple of years on end, I'm like, I love them because they want to get better. But the folks who drown out after 5, 6 months and they just make excuses, I'm like, how you do anything is how you do everything. So if you're complaining that you can't get the workouts done in the first 2 weeks, then you're not running this marathon. You're not losing the weight. You're not getting six pack abs. So how do you see that with the clinical cases? Because that's not even arguably, like, it is more important on your side of the equation than like running a marathon. Like, you're trying to get people up and walking and healthy after surgery.
Yeah, 100%. Like, agree with everything that you said there. The mind is everything, right? Um, I kind of off of the quote that you used, I really like the saying, whether you think you can or you can't, you're right. If you wake up every single day and you're looking for that nagging pain in your knee, you're probably going to find it, right? But if you also approach your rehab from that standpoint of, I'm going to get better one step at a time, we're going to do this, but I know that down the road, like, it is out there, and you're focusing on those positives. You're not focusing on the fact that, oh, when I make this weird extraneous movement, my knee still hurts. You're like, hey, I was actually able to, go down the stairs pain free today. I was able to, do a goblet squat without pain today. Like, this is awesome. If you celebrate those little wins and you can, truly believe in yourself that long term, yeah, hey, you can do this. Like, you can make that change. Yes, way better outcomes than, in the people who, again, wake up every single day and they're looking for that pain and they think that, this isn't going to work. I can't do this. So there's 100% a mindset aspect too, where you need to almost become that person who doesn't have pain, right? You need to start acting how that person would act. And I think that gets even harder again when you are one of those people who has tried everything and nothing has worked for you so far. I think that can be really tough mentally because you're like, well, nothing's worked so far. Why would this work? But the people who continue to have that hope and continue to advocate for themselves and try something different, those are definitely the ones who find the success.
Do you have, I guess, any examples of people who you have like treated, or like colleagues who have treated or tried to treat, who after, different type of therapy after different type of therapy, they were just almost impossible? It's almost like that funny joke of like, how many, therapists does it take to change a light bulb? And it's like, well, one, but they have to want to change. It's like, that's the same thing that I'm kind of trying to say here is like, have there been any cases that you've had where someone just didn't want to change, but they were almost forced to go there? And like, what do you do in that situation? Do you just like wish them the best and give them all the resources and say, hey, the rest is on you now, it's up to you to do the homework?
Yeah, great question. I would say, as I started my own virtual practice here, I'm very, very lucky in the fact that I tend to attract people who are very high achieving and very active. And so, like, they love exercise and they love movement. So they are willing to try anything to get better. So they don't really have so much of that limiting mindset because they love the process as well. They want the outcome, but they really like, they're nerds at heart too, and they enjoy the process, right? But definitely in the past, I have certainly had people who kind of would just continually say, like, is this working? I don't think this is working. And then you kind of go that route of educating them on, more of the nervous system and the pain science aspect, and, how influential your brain can be, and hope that that touches a nerve. And I think a lot of the times for people it does. I did have a case one time in the clinical setting where the woman really did. She wanted to get better so bad. She did all of her homework, and she would leave the clinic feeling great. And I had, enlisted help from some of my other colleagues, because we just couldn't figure it out. They would give her homework and, work on her in the clinic. She would walk out feeling great. I would work on her, walk out feeling great. And every time she would come back in, and, you know, she was all kind of in a lot of pain again. So it wasn't sticking. And so we had just an honest conversation, like, hey, like, here are some other factors that can affect pain. Are any of these going on in your life? And luckily, she was really open with me, and was, you know, open with me and telling me that she had a lot of trauma going on in her life. And she was like, I've been reflecting on this actually. And you know what? I'm really angry. I had XYZ go on. She's like, I think I need help about it. I think that that could be why, where a lot of this is coming from. And she did get help with that, and, tried to take care of the mental side of things. And that did help with her pain too. So, it can be tough, but, I think the most important thing when you are hitting those walls with people is just trying to have that open conversation with them.
Is that something that maybe you had learned in school, or is that more on the job training of like, listen, like, you're not only there to be a physical therapist, but you're also there to be a therapist. You're there to be sort of a friend and a coach. Was that a part of what you did? Because I know, for example, I know like a lot of doctors and PAs and some nurses, like, there's more of that well-rounded bedside manner holistic approach that they're supposed to do, and we've
Mm-hmm.
all met people who just like don't fit the bill, and other more empathetic people who are like, wow, you go into a room with them and you feel like $1 million. So what's that like in your experience? Because there can be definitely the hard-nosed folks out there who are just kind of screaming, and the drill sergeant is like, nah, that's not what we need here. But there are the type of people who are just like super empathetic and also a little bit optimistic and will push you in the right direction.
Yeah, absolutely. And I think that that is what is most needed, because from any healthcare professional, whether it's a physical therapist or your medical doctor, whoever it is, if you, as a patient, if you don't feel like someone is listening to you, it's going to be really hard to listen to what they have to say, right? Like, why should I trust you and what you're saying when you're not truly hearing, what I'm telling you, right? And so even if we don't agree with what somebody's saying, even if we, they tell us what they think is going on and we don't agree with that, I think we need to be receptive and listen. Like you said, you need to kind of act in that therapist role and that friend role, and kind of wear many different hats as a healthcare provider, right? Um, because so many different things do influence the body, and you need to build that trust first and foremost. Like, if somebody doesn't trust you, they're not going to listen to you. And going back to the mindset aspect, they're not going to believe that you can help them if they don't trust you, right? So, going back to that, how do you build that trust? Listen to them. That is the most important thing for sure.
There's that reminds me, and I think that's absolutely brilliant. There's two things that reminded me of. The first is, have you ever heard of the cocktail party effect?
I'm not sure. Elaborate.
You've probably heard of this before, and you probably had this as well too. And I think this is amazing, and everyone can vibe with this. It's that you're in a crowded party or like a bar or something, and it's just everything's background noise. You're hearing a little bit of a conversation here, a little bit of conversation here, a little bit of conversation there, but in general, you can focus on the person in front of you because you're having a conversation. But the second someone says Shannon did this or Shannon, it's like you're like, where is that, where's that coming from? And it's like that one word, it's your name is the most important name, and you start listening. The cocktail party effect. And another thing too is there's a great book called Dale Carnegie's How to Win Friends and Influence People. And one of the first chapters is use people's first names, because someone's first name is the sweetest word in the sweetest language, said in the sweetest tone that they will ever know. So if you say, "Hi, Shannon, how are you?" It lets you know that, like, I hear you, I see you, we have commonalities, and I'm acknowledging you. And I always look at that when I go to like commercial gyms around here and I see these physical therapy, like personal trainers, and they have like a little notebook and they're like walking to the equipment and the person's just kind of shy walking behind them. And I want to like slap the trainer and be like, hey, walk beside them. Don't walk in front of them, walk beside them. And it sounds like you take a huge interest in your clients and the people you coach and treat, because they need to be heard, they need to be seen. And when you have that trust, the outcome's going to be much better, right? You're going to be happy, you get, the money, and like they're happy because they just feel better, they're more confident.
Yeah, 100%. I mean, why would you, listen and have confidence in somebody who's not listening to you, right? You need to feel like this person has my back. Like they're going to do everything that they can to help me. Like they truly care about me, right? So if someone doesn't feel like you care about them, that's just setting up a very poor relationship and poor outcomes as well. And I think most of us who go into this field, like we go into it because we do really care and we do really want to help people, right? And kind of going back to our first conversation, again, that is why so many people are starting to move away from the traditional model, is because you can't provide that care that we all want to in that traditional model. But, when you kind of go outside the box, you can wear all of those hats and you can give someone the time that they deserve. Because sometimes a session might not look like an hour of exercises. It might look like 30 minutes of talking and 30 minutes of exercise, and that's what they needed on that day.
Sure. You had brought up a really interesting point that I wanted to dive in a little bit further. You had talked about when you were coming up in high school and then college, and you're like a big athlete with volleyball, that you were focused on this performance outcome of being a strong volleyball player, but you, like everyone else, also has to look in the mirror. And you
Yep.
said, hey, like I might not be as happy with the way that I physically look, despite the fact that I'm performing in volleyball. So you tried like the caloric restriction, you tried added cardio, and it wasn't until you tried out weightlifting in a very scientific, periodized sense. You have your strength and conditioning certification, your USA weightlifting, so you know what you're talking about. Like that, you focused on those performance outcomes, that things started to come together. Is that something that you see and have had to coach, especially in like a performance based, you know, clientele that you have, as well as some of your PT clients as well?
Yeah, absolutely. Especially women specifically, and I work with primarily women. I work with men too, but a lot of women. Um, we are almost like conditioned to, have that mindset of eat less, under fuel, but work out really hard, and that's what's going to get you your goal body, right? And that's just not the case. And, especially again, as this whole like kind of anti-aging and longevity movement is coming forward, a lot of women are realizing too that we need to fuel our bodies. And that was another part of the game changer for me too, was not only adding in like progressive overload training and actually working hard and trying to build muscle, but also learning to fuel my body. Don't just cut carbs and try to eat as little as possible. That's going to backfire. Like you need to be eating enough protein for your body weight and to support your goals. You need to be eating throughout the day. You can't just try to starve yourself. One meal a day. That's not super optimal, right? You need to be fueling yourself. Carbs are good. Carbs are going to give you energy and they're going to fuel your lifting sessions, so that way you can build muscle and the cycle continues. And then going back into that mindset aspect too, you need to appreciate all of those things as well, and appreciate how far you've come, and focus on what your body can do, because if you're always chasing that next best thing and focusing on what you don't have and what you don't look like, back to that mindset aspect, you're always going to feel less than. So that it all ties into each other there.
There was, I think it was, I don't know if it was Serena Williams or another, like, I mean, Serena's like the GOAT. Like, it might have been her who said like a while ago that she took a bunch of heat for, her body. She was like very, very strong and she wasn't as like curvy, so to speak. But she's like, hey, I'm the GOAT and I fuel correctly and I'm strong. And this is what produces all of these titles. And that always stuck with me because I was like, I had that same thing when I was like running a bulk of my marathons and my ultras of I wanted to be as lean as possible while running 100-mile races and stuff. And it was like, okay, yeah, like I looked good, but I mean, like there was like definitely an obsessive component that I don't know, probably after the age of 25, I like kind of got away from it. I don't know why, but I did. But like before the age of 25, I was like super obsessed. And now I'm like, oh no, I actually feel good. And I feel good when I eat, as you said, carbohydrates, eating loads of the fruits, the veggies, the whole grains, the things that make me feel good. And like pushing to the side more of like, the candy and the soda and all the other junk. And that's just like, I always ask my students who are like, freshmen, sophomores in college and some of the grad students, I'm like, how do you guys feel about this? Like, do you just fuel, or do you actually care about what you're putting in your body? Because now there's that component too of, oh, I can probably get away with eating 100 calories or 120 calories of a little Doritos thing, but am I going to cognitively crash afterwards because I'm going to go hypoglycemic? And
Absolutely.
I'm happy that we're having more conversations around this now because maybe 20 years ago, people didn't have podcasts to talk about these things and YouTube channels. But I remember when I was coming up in high school, I was reading forums on bodybuilding.com and just trying to make sense of what hypertrophy was. And I was like, oh, hypertrophy. But like it wasn't around. So it's
Right.
like now it's ubiquitous, but you have to find out like what sources you can listen to help guide you along the way.
Absolutely. And it's so much more um, accessible now. Like you said, there's podcasts, and with Instagram, of course, you have to be careful where you're getting your sources from because it's almost too accessible. Anybody can post advice these days. So you need to know where you're getting your information from. But on that same note, I think there is a benefit to it because, kids and, people in the older generations as well who didn't have this knowledge, they're able to now learn this. And it's never too late, right? Whether you're in college and you're able to now set yourself up for success by fueling your body with whole foods and protein, or, maybe you're a woman in your 50s who was taught to chronically undereat and now you're in menopause and you feel like your body's changing and you don't know what to do. Like, hey, it's never too late. Now like you have these principles, like they're at your fingertips. There's so much that you can consume to rectify that.
Do you feel that you have a bit of a responsibility or a duty? And then like, I mean, you're very open on like Instagram with all of your knowledge that you put in there. So I'm guessing like the answer is going to be yes, but you're very open with your knowledge and everything. Like, do you feel that you have a responsibility as you being a DPT and the strength coach and like the USA weightlifting coach that you feel the need to, even if it's not going to change all of social media, at least put out the good information because there will be some people who will follow that.
Yeah, 100%. Um, because like I said, I've gone through all of this myself, and I think a lot of the times we're given our specific struggles in life so that we can help others overcome these things too, right? And so I've been there where I've listened to all of the trash advice and I've tried that and I've wrecked my body with it. So I absolutely feel like it's my duty to help other people who have struggled with the same things that I have, whether that's, an injury, whether that's not loving how your body looks, not loving how it's moving, um, not knowing, just where to even start. You're feeling overwhelmed. I definitely feel like it's my kind of purpose in this world to, help teach what I have learned. And help spread that information so that other people, like I said, don't spend 10 years and hundreds of thousands of dollars and a lot of trial and error, and a lot of failures, trying to find these answers. I want it to be all right there in black and white for people.
Yeah, no, I think that's really, really good. And I think more people need to adopt that mentality as opposed to just chasing likes and followers, but actually put out the good information. And then I know it's like, I know cliche or some people might roll their eyes on it, but when someone says like, if you truly love what you do, then you'll never work a day in your life or whatever. And I think That's very true and honest, because when you can find something that you do that you lose the hour of the day in because you're like, oh, I want to learn more about this, or when you're driving on the road or you're walking somewhere and then your head just kind of drifts off to the exact same thing, you know that that's important to you. I remember being in Disney World with my older brother during my master's, and I was like, I think I was 22, and he used to work at Disney, big Disney guy, and like he's like, hey,
Okay.
if you come with me tonight to the fireworks show, I'll get you ice cream, and we're gonna get some buddies together. And I had this idea to write a book, and I like I like self published these two books. My first one, I wrote it in like a week, and it was just on like how to be healthy in college with respect to dorm room workouts, rec center workouts, how to navigate the dining hall, and I couldn't stop thinking about it. And I was like, I could do this chapter, and I could talk about this, and I could debunk this. And I was like looking around at all these people who spent thousands and thousands of dollars to go to Disney with their little kids and they're watching the fireworks. And I was completely distracted. And I was like, oh, like that's become a theme with everything that I do, that I will always be completely distracted unless I can like settle that voice inside my head of what I need to be doing. And it sounds like I'm speaking with someone who like knows the exact same feeling of like, no, I'm going to keep learning, I'm going to keep helping, and I'm going to do what I was put here to do.
100%. And it's so true. When you follow that passion, it doesn't feel like work because it's your passion and it's fun, right? So whether it's, taking a continuing education course to learn more, to help more people and serve more people, like that's fun. Or, during my client check-ins, one of the best testimonials I ever had a client say was that our weekly check-ins were like chatting with your best friend who's really smart. Like, and that's exactly how it feels too when I'm talking with my clients, is it feels like I'm just giving health advice to one of my friends. Like it's fun, and the time flies because you're just talking about what you love and what you're passionate about.
How like on that, what opinions have you had or insights that you've believed to be true, like, and that have maybe been debunked? What has changed over maybe the past 5 years for you that you go, ooh, now in 2025 we do things this way, or now I think this but I used to think that? Is there anything like specifically within your field or your interest that has changed? Like I always thought that like you had to eat every 3 hours in order to maximize muscle protein synthesis and hypertrophy, but a lot of people thought that. And then like as science came out, it was like, oh, actually like 24-hour protein intake matters more than timing. Okay, so we learned that. So what's that like for you? Is there anything on there?
So, from a personal standpoint, one of the biggest things that I learned, and this was early on in my journey, and this was again kind of a debunked thing, but I think a lot of people probably fall victim to this, is I thought that just if I ate clean and I ate healthy foods, that you can eat as many healthy foods as you want throughout the day and you're going to lose weight, you're going to look good, you're going to feel good, right? Because it's healthy foods, it's clean eating, right? And that is not the case, because even clean foods, even whole healthy foods, they do indeed have calories, right? They have a caloric intake, unfortunately. Um, and so personally, that was one of the biggest things that I learned and kind of changed the game for me. And I think a lot of people still feel that way as well, because, we're told eat whole foods. And I was like, okay, I was loading up my plate with rice and salmon. And then, when I actually tracked my macros and learned about all of that and portion control, I was like, I'm eating enough food for a linebacker. Yeah, it's healthy. But I'm sitting here wondering, why aren't I losing weight, to the people who are eating paleo, and when that was a big thing. And whole 30, it doesn't matter. Like, yes, we want to fuel our body with whole foods, but also if you have a specific goal in mind, you need to be mindful of how much food that you're putting in your body too, because, healthy foods do still add up. That was probably, from a personal standpoint, the biggest kind of debunked myth I would say that I learned.
No, I love that. I think that being an athlete, like you kind of just learn to have your copy and paste meals, to
Hmm.
fuel up for a workout, get through the workout, recover, and then get back at it the next day. And a lot of people are like, they don't really think about it until like you get away from the actual competition, you start working and you're like a normal member of society. And maybe you're still very active, but you're not nearly as active as you were when you were young. And it's funny you said that about like the clean eating, because that's always been a topic of debate with respect to, you know, flexible dieting and if it fits your macros. And I would always say, like, and I think we're all in agreement that, like, eating whole foods is much better than eating highly processed foods. But yeah, like if you sit around all day long and you don't move and you're just eating, you know, tons of fruits, veggies, whole grains, and proteins, but you're overeating by 2,000 calories. Like, yeah, you're gonna put on body fat. Doesn't matter. It's like you can eat all the salads and steak and protein shakes you want, but if you're not moving your body, it will add up.
Yep, exactly. And on your note with flexible dieting too, I think that was a huge game changer for me too, because again, like I originally approached all of this with that mindset of only healthy foods, only clean eating, and then that didn't work. And then when I learned, oh, we want to eat mostly healthy whole foods because you're going to feel better, right? And it's good for you. But don't be afraid to incorporate, some cookies and some ice cream and some fun foods here and there. And oh, if it's portion controlled, like you can fit this in and still hit, your body composition goals as well. So I think, finding that balance is huge too. And I think makes it more sustainable for people as well.
Yeah, the balance component is probably the biggest thing. And I've been stuck on this idea for a while, and I always kind of like talk with my friends about it, and then I write it down and I research it and I listen to podcasts about it. Is this idea of just like consistency,
Hmm.
in that I don't think, like, I was watching the Eagles game last night or yesterday, and it was like the Eagles and the Chiefs. Are you not? Who do you like?
Unfortunately, I'm a Giants fan.
Oh, I was surprised that they went that deep into overtime with the Cowboys. I thought the Cowboys would have destroyed them, but I was
Ugh.
cheering for the Giants in that context. But I have to wear like my Eagles shirt today because I was just like, Tom Coughlin lives around the corner, so I said hi to
No
him a couple
way. That's
times.
hilarious.
Yeah, but I don't know, it was funny because I was like watching the game, and it's like Jalen Hurts versus Patrick Mahomes, and I think Michael Jordan showed up like the first week, and I was like, wow, like the GOAT for basketball, a couple of incredible quarterbacks. They'll probably be both Hall of Famers. Tom Brady's color commentating it. He's the GOAT. And I was like, what makes someone great? And what I realized is that it's not just one day. It's not watching one, David Goggins video where like, yeah, I'm going to go out and run at 100 degrees. It's like, no, it's showing up and deliberately doing your best every single day of the week, and then meaningfully trying to get better every single day.
Absolutely.
And I don't know, I have this idea now where I was like, if I just run every single day, now I'm fighting time. I'm fighting sarcopenia. I'm fighting osteoporosis. I mean, I just turned 30, but I was like, hey, like it's all downhill from here. But if I keep showing up every single day, therefore I still am getting better because I'm getting older. And I think that's really what it is with all of the stuff we were talking about, performance and weightlifting and getting back after injury and all this other stuff. And it's like, you know, becoming a type 2 diabetic or having metabolic syndrome doesn't happen in isolation. It doesn't happen with one slice of pizza. It happens with years and years and years of not doing your homework. So if we can just shift that mindset every day to be like, hey, like every time you sit down, have a glass of water and have one serving of a fruit and vegetable and move your body for 20 or 30 minutes, and like the cascading snowball that happens over the course of a week, a month, a year, 10 years, 20 years, holy cow. And then we're starting to see those people who are 60 and 70 playing pickleball. And you're like, wow, good for you. You're 70 and being very agile. So
Yes.
I'm really excited to see where this field is going to go.
100%. I completely agree with everything you said there. I think consistency is absolutely the key with all of that. Um, and, the key with consistency too is we all know life is going to throw us off track sometimes. Things happen, work happens, family stuff happens, and sometimes you're going to have, a period of weeks, maybe even months for some people where, you aren't on point with your fitness, you aren't on point with your food, but if you have a decade behind you of consistency in that area, then you have that confidence that, well, I've been doing this my whole life. I'll get back on track when this, work project is over, when this family situation resolves, whatever. So I think there's a lot of, credit in that too, is like working on building that consistency over time. It almost gives you a little bit more confidence and freedom when something does happen and you can't always be as consistent as you want. Hey, I'm going to get right back on track with this because I've been doing this my whole life.
Yeah, it's that like identity shift of
Yeah,
having like undeniable proof that you are who you say you are.
absolutely.
And like I always think about it whenever I fly out somewhere and I'm like doing like an entire day of travel and I'm like, oh, maybe I'm in the airport for an hour or two, on the flight for maybe 6 hours at a time if I'm flying cross country, then I sit more, and then like at the end of the day you just feel gross and just kind of groggy and everything's sort of stiff and hurts. And I question like, am I really an ultra marathon runner? Am I really fit? And I'm like, Mike, it's fine. It's one day. Like it's completely fine. Yeah. And then like I have that undeniable proof in my head of like, I ate healthy today, I'm gonna eat healthy tomorrow, and I'm gonna exercise tomorrow. But I think that a lot of people don't have that. And those are the types of people who like you probably are contractually obligated to see and help. And it's a beautiful thing to help, but it's almost like, can we take that away? It's like you don't have to throw the baby out with the bathwater and just
Yes.
completely fall off your exercise habit, your stress reduction habit, and your healthy eating habit. Like just get at it every single day. And for the most part, things will work out and you won't have metabolic syndrome.
One, yes. To be extreme, you won't have metabolic syndrome. But absolutely, 100%. And I think that's where a lot of people fall short and why they give up and why they're always starting on Monday, starting in the new year again and again, is because they think that, they want to be perfect with it rather than consistent with it, right? And they, have that one day where, they traveled and they feel off and then they just say screw it for the rest of the week, and the week turns into 2 weeks, which turns into a month, rather than just saying, all right, this was one day, we'll just get back on track the next day, right? People think like, oh, I broke my streak, it's all over, like screw it, I'm done. And that's where you start to fall into those negative patterns, versus when it really is your lifestyle. You're going to have those days, they happen, but you just get back on track and you have more good days than not.
Yeah, there was it reminds me of a funny scene. Did you ever watch Modern Family?
A little bit, not like a ton, but I've seen episodes.
Yeah, if there's a show that'll make you belly laugh every time, I think Modern Family is one of them. And they were uh Mitch and Cam are like one of the couples, and Mitch was saying, he was like, oh, like I forgot to do this thing because I put it in my gym bag, and then I felt bad because I realized I haven't been to the gym in like 6 weeks or 8 weeks. And I was like, ha ha ha, do people really do that? And I was like, yeah, the answer is yes. There's people who won't exercise for 6 or 8 weeks or ever. And
Hmm.
like when I got out of college and grad school, so for the first 6 years before PhD, for another 4 years, I had so many friends reaching out to me being like, hey, like I see that you're coaching, can you coach me? I haven't exercised in a while. I'm like, yeah, sure. Like, and we're 6 years out of high school. And I said, when was the last time you formally exercised? And they said, probably gym class, when we had gym class back, together senior year. And I'm like, that was 6 years ago. And they're like, ha ha ha, yeah. And I was like, and you want to run a half marathon or you want to get abs? I'm like, you got to go outside and take a walk right this second. Go and take a walk, like 20 minutes. It's better than nothing.
And then tying that back to the injuries, that's where a lot of people kind of go wrong too, is, again, they go from, it's the perfection and the consistency, or they go from 0 to 100. Like you need to build up slow and steady, right? Like with anything, that's what's going to get you consistent, and that's what's going to make it a long-term habit change rather than just a little 8 week, challenge or whatever. But that's also, what's going to keep you healthy too. So many people just want that like instant gratification.
Yeah, I think that could be one of the downfalls for sure about like social media, because I fall into that too, where I see some athlete qualifying for some race or squatting or bench pressing this much and they're absolutely shredded. I'm like, oh, I could do that too. And I'm like, no, I already worked out today. I don't need to go to the gym another
Right.
time and then another time. Like I have a job, I have a life, I have a family. So I'm like, you can't like keep doing that. But yeah, it's crazy. Is there what would you like to see within your field specifically within the next 5 years? Even if it's a little bit of an overzealous goal, what would you like to see change? If you could like have this infinite ability to be like, I'm going to enact this change and it's going to have a huge positive impact on what we do.
That's a really great question. I would just love to keep seeing the more holistic approach continue to grow. I think the more we can attack, the root cause of what's going on, stop slapping band-aids on people, start looking at people as a whole person rather than just, an injury or, a pain point. Because as we've talked about, like there's so many things that can impact that. There's so many things that can play a role, and there's so many levels to what can make you, age strong and, be able to do the things that you love long term. Um, so that's really what I would love to see is just a more holistic approach to care and wellness in general. Even if that's not just in the physical therapy field, but maybe more collaboration amongst providers, right? Rather than just, oh, go see this doctor, go see this doctor. Like, why don't we all talk about what's going on? Because, your hormones and your nutrition and what you're doing with your personal trainer and what you're doing at work, that all plays a role in everything, right? So yeah, that's, I think, the biggest thing, and what I think the biggest game changer would be is if we can continue to just deeper explore root causes of things, have a more collaborative and holistic approach and a more whole body approach. I think that's going to really change the game to health, wellness, and just living a full life rather than just existing as we age.
Yeah, you're looking at, let's make this thing better. Let's
Mhm.
not just settle for okay. Let's make it the best. Do you
Exactly.
think, if again, like just forecasting, like given the opportunity, if you could have all of that under one roof, would you like to see that happen in a highly collaborative, interdisciplinary approach of like, in this suite we have physical therapy, in this suite we have occupational therapy, in this suite we have nutritional counseling, in this suite we have sauna and massage therapy, in this suite we have nutrition? Like, would you like
Yeah.
to see that if possible?
Yeah, that'd be pretty cool, right? If you can just have this giant warehouse that's a gym and we have all these recovery tools, and then, you can also have your sauna and your cold plunge, and then we can also go get, your hormones tested and see what's going on there if that's playing a role with anything, and then we can also have your mental health services as well. And let's teach you how to eat. Maybe we have a nice healthy food bar here too. That would be pretty cool, right? I'd pay good money for a place like that. Have
Yeah, maybe
everything
that could
under the roof.
maybe that could be your I don't know, 5 year, 10 year, 15 year plan. Is
Yeah, I
just
would
to
live there.
reverse engineer that, right? It's like, I don't know,
Yeah,
I like to put these ideas in people's heads of like, if you could do anything, what would you do? And they say it, I'm like, all right, start reverse engineering it. Why not? Like, you only get one shot at this thing, you might as well try.
yeah, absolutely. Oh, that'd be pretty cool. Yeah, we could put like a little resort on top. Like it could
Yeah,
be a
Four
whole little
Seasons
wellness
style. Yeah, there's like
retreat.
an
Yeah,
infinity pool up
exactly.
there.
Yeah, I like that.
Yeah,
That's
talk
that's my
about
speed too.
yeah, talk about like reducing sympathetic output. Like, you're just funneled from one healthcare provider to another who truly cares about like your mental and physical well-being. Why
Right.
not?
Exactly. Yeah, I think the more we can take care of that and yeah, just focus on the person as a whole. I mean, that is going to be the biggest game changer for sure.
That's awesome. So, with that, is there anything else you wanted to cover? I think this was wonderful, and I know that I gained a ton of valuable insights from this. I know like all the viewers and the listeners will also as well. So, is there anything else you want to touch upon before we log off?
Oh man, I think the only thing I would say is to anyone listening, if you are somebody who has ever felt like you aren't being listened to by, a healthcare provider or, a personal trainer, whoever that is, but that in your gut there's something going on, even if your doctor says your MRI shows there's nothing wrong. If hey, there's something else going on here, be an advocate for yourself. Keep trying, don't give up, listen to your gut. um, that is the biggest thing that I would say is, the people who, those more difficult cases, right? I put that in quotes. The people who do get the answers, they're the ones who continue to advocate for themselves, and it's hard. Sometimes it can be really grueling, and you feel like you want to give up when no one's listening to you, but you will find someone who will listen to you, and that person who listens to you is going to be the game changer. So don't give up. Keep advocating for yourself if you know that something's up.
I love that. Be an advocate for yourself. There's there's a statistic based off that, and I think it's brilliant. Is people who have dogs typically love and care about their dogs significantly more than they love and care about themselves, to the point where, like, if a dog has an ear infection and they need to get their antibiotics, like, in general, the dog parent, the dog owner, whatever the correct terminology is, the dog will get like greater than 95% of its antibiotic. And some dogs are very resistant to that.
Right.
But like the average human being taking an antibiotic will only go 30% of the way. It's like a failing grade. So it's like, if you love yourself and treat yourself just as much as you love and treat your dog, your health outcomes will be the best. So, as you
I
said,
love
very
that.
much advocate for yourself, treat yourself like your own dog or your own kid or
Yourself
whatever.
like you treat your dog. That's awesome. I'd be treating myself great then.
Yeah, yeah. Keep getting the chew sticks and everything.
That's awesome. I love that.
Awesome. So with that, Dr. Russell, thank you very much for coming on to the show today. This was wonderful. Thanks for coming on.
Yeah, thanks so much for having me. This was great. I really enjoyed our conversation, and I hope people get some good nuggets out of it.
Where can they find you? Because I'll put your like Instagram handle down in the show notes.
Awesome. You can find me at Dr. Shannon Russell on Instagram, DR, and then there's a period before Shannon. And that is my main source. I also have a website, drshannonrussell.com. And yeah, I'm most active on Instagram though.
Awesome. So with that, we'll see you all later.
Perfect. Thank you so much.